Okay, good morning. I, Roger Botten, call a meeting of the Student Attendance Advisory Committee to order at 9 o'clock. Could I have the recording secretary perform the roll call? Present.
Present.
Carrie Pruitt,
Present.
Charles Aglabat, Riley Killingsworth,
Present.
Shelley Buchanan. Thank you.
Are there any public comments?
Let's move on to the next item.
All right. If you want to take a look at our meeting notes from September 8th, I'd like to get a motion to approve the minutes from September 8th.
Carrie Pruitt, for the record, I move to approve the minutes.
Jason Tribune, all second.
All right. Are there any public comments?
No public comments received.
All in favor?
Aye.
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 Any opposed? Oh, that so passes. All right, then we'd like to move on to 201 approval. Oh, we did that. 202 presentation and discussion to provide an update on the middle school engagement project, a Washoe County School District pilot program to address chronic absenteeism.
Good morning, everyone. Doug Taylor, attendance coordinator for the school district. For the record, just wanted to give you a brief update. We've talked about the middle school engagement, attendance and engagement program before. That's a privately funded grant that pays for intervention prevention assistance at 6 middle schools. Each assistant shares 2 schools. Also provides for funding for paying teachers to teach after-school extracurricular clubs, activities, those kinds of things, and provide some funding for materials and supplies for those clubs, including a specific requirement around a VEX robotics program, which we do have up and running at all 6 schools. The update that I have for you today is as the committee knows, we've had some difficulty in maintaining people in those positions, largely due to the fact that they are grant funded, and so every year we have to wait for grant funding to come back through again, and so frequently people have been able to find other opportunities while we've been waiting to hear that grant funding has been renewed. But as of now, we are fully staffed in all those positions. We were able to move the intervention preventionist that had been at Clayton and Cold Springs, requested transfer, and so we moved him over to Shaw and Mendive. And then we were able to hire a new prevention intervention person to serve Clayton and Cold Springs, who's now been in place for about a month. And so we've been fully staffed for the last month or so in those positions. One of the things that the folks in those positions do is case management light, I'm going to say. It's not like formal case management, but they identify students that need additional supports at the schools. The goal is to serve 100 students at each of the 6 middle schools over the course of the school year. And so we use a spreadsheet to track those, both initial contacts and additional contacts past that initial point. And at this point, we're on track to meet our goal of 100 students at each school by spring break, which is the goal I set at the beginning of the school year, or actually at the beginning of the grant. Because as we know, if we don't see the students, in a timely fashion, if we're not seeing them until after spring break, it's probably too late for us to make a significant difference. So we're on track to do that. Robotics programs are up and running at all 6 schools, and we've had some really good support this year in terms of clubs and activities that are going at the schools. Billinghurst especially has been really a rock star this year in terms of the support they've been able to provide for their students in terms of having clubs and activities going. So that's kind of my update for you. Does anybody have any questions?
Roger Botten for the record. Do we take data on that, start at a baseline to see what our attendance rate is, and then measure through the program and see if it's affected that or
We
not?
do, yeah. We actually, we work with the accountability department in terms of doing longitudinal study, but we also, one of the things the intervention prevention assistants do as a part of their own maintenance on the spreadsheet reporting to me is we use the average daily attendance tracking tool in the district software BIG, which allows you to enter a base date and a comparison date to look at what was average daily attendance prior to our initial contact, and then let's say we put an intervention in place for a student where they're going to meet with the interventionist, every week or a couple times a week, whatever they're doing. It looks really different for each student. But we do that for 6 weeks, and then we look at the comparison date, and we are able to see, did average daily attendance increase, decrease, or stay the same during the period of intervention that we were trying for that student. And then based on that, of course, as you well know, Roger, we would then decide, is that intervention that we're doing effective, or do we need to make changes to it, or has the student shown, enough improvement that we can start to fade back the level of support that we're doing. And so depending on the student and the intervention and the situation, we might take a lot of different actions, but absolutely we track that data.
Carrie
Thank-
Pruitt for the, oh, sorry, go ahead, Roger. Yes. We may have talked about this in the past, but do we anticipate any additional funding to push this project past the pilot stage?
We hope so. Right now, we have funding through the end of this school year. We do regular meetings with the grant funder who wishes to remain anonymous. But we do have regular meetings with them, including Dr. Paula Marca and Rochelle going to those meetings. And the feedback that we get from the funder is very positive. There is appetite to continue funding. We don't have a guarantee of funding past the end of this school year, but we are hopeful that there will be continued funding past that point.
Thank you.
All right, well, thank you.
Thanks, everyone.
Move over to 2.03, update on the current chronic absenteeism rates in Washoe County School District. Intervention Department plans to provide more extended supports in further effort to reduce chronic absenteeism.
Okay, good morning, everyone. Rochelle Muriel for the record. I wanted to share with you some of our latest data around chronic absenteeism, and I'll remind you that chronic absenteeism is a percentage. That's so it fluctuates day by day depending on the number of days that students are missing and the days that they're enrolled. Again, students are chronically absent if they've missed 10% or more of the days that they're enrolled. So I want to show you or bring your attention up to the screens. This is our so as of today, this is our chronic absenteeism rates. Again, they fluctuate based on attendance with students. And these are our district-wide data. Let me scroll down a little bit so you can see. So about 21% of our students currently are chronically absent. This is lower than last year, so this is positive. It's still high for us, right? It's not normal yet for us, but it is lower than it has been. And so glad to see that these numbers are trending down. We typically see chronic absenteeism rates tick up during the holidays and then during second semester. So we're hoping that this remains low for the remainder of the year. Schools and intervention department staff have been doing quite a bit. And so let me go through this just a little bit more so that you can see a little bit more data. But you'll see that about 7% of our students are severely chronically absent. And that means that they've missed 20% or more of the school year or the days that they've been enrolled. And then about 10% of our students are approaching being chronically absent. And so this year, you may recall that we determined that we were going to focus our attendance officers to intervene earlier. And so they are trying to work with that 10% population so that we can avoid students become chronically absent. So we do have attendance officers putting students on formal attendance monitors, even when they're approaching, so that we can intervene earlier and hopefully avoid being chronically absent. So we're working on that this year. We also extended our attendance monitors from 20 to 45 days. So we're working longer with our students so that hopefully we're seeing some positive progress with our students. And then every student that we work with, we have a goal of connecting them with a trusted adult at school so that when we close our cases, they continue to have a positive adult at school. So we're working through some of that and trying to work through that. And I'm hoping that I can give you some more data at the end of the year. How did that go? What were our challenges? Those kinds of things.
Any questions?
I'm not quite done yet. Just wanted to show you the special populations and the grades. Again, our children in transition are students that are the most chronically absent and the most severely chronically absent. We're starting to see our students in foster care tick up with their chronic absenteeism, unfortunately, Carrie. And then I think it's our Pacific Islander students of our race and ethnicity have the highest rates of chronic absenteeism. The grade level, again, is pretty typical, although still higher than normal, but we typically see those younger pre-K kindergarten students are more chronically absent than first, second, third, and then we see chronic absenteeism tick up as students get older for a variety of reasons. Sometimes students are having to work, and so they, those seniors are having to work, and so they miss school. Or sometimes students have been chronically absent for many years, and so now we're seeing those academic gaps that are having our students struggle as they get older into high school and the curriculum gets harder. So those are a couple of reasons. It's pretty complex, but I'm simplifying it for the purposes of this meeting so that we can get out on time. Any questions about this data? Okay, finally, I just wanted to update you. I've talked to you all in the past a lot about what our intervention department does. I'm going to highlight a little bit today and in another agenda item what our family resource centers are doing to address chronic absenteeism as well from a different lens, working with attendance officers. But we do have a new position that's started this week. Doug is overseeing that position. It's a re-engagement facilitator position. That person is Nisa Butler. She'll be working really closely with schools to provide additional professional development. So professional development for teachers, professional development for other staff, and also for parents to give them strategies and ideas and resources around how do we establish at young ages, kindergarten and first, second, third, how do we establish good attendance habits then so that students are better prepared to be successful as they get older. So she'll be working on that. We're also trying to strengthen the check-in, check-out intervention that a lot of our schools say that they're doing and are doing, but it looks really different depending on the school. And it looks different across each person that does it. So we're trying to work in strengthening that at the middle school level. And those schools that Doug Taylor just talked about, those are the schools that we're piloting. So we're trying to standardize that check-in, check-out. We're trying to make those conversations more meaningful and more of a mentoring sort of intervention at a middle school level. So she'll be working with the middle school staff that Doug has in strengthening that and pairing students with staff at a middle school level. So we'll be able to kind of tell you how that goes soon. And then you should be seeing some parent trainings and such in partnership with Family School Partnerships too. So we're excited to see how that goes. And we'll continue to support school sites so that they develop some of their formal attendance plans, looking at data and providing some early intervention. When we've got about 21% of students chronically absent, we're talking large numbers, right? So this has got to be a sort of a comprehensive, collective, everybody on board approach to chronic absenteeism. Questions?
Okay, we'll move on to 2.04, committee member updates.
Okay, this is a standing agenda item that I have just for anyone else that wants to update us on some of the efforts that their agency is doing in terms of impacting chronic absenteeism or impacting some of our students, particular populations. And I asked Carrie to update us on what Human Services Agency is doing currently around chronic absenteeism.
Thank you, Rochelle. I have some prepared notes for you folks, since there's a lot going on. With regard to attendance, Washoe County Human Services collaborates with the school district on chronic absenteeism through shared lists of all chronically absent foster youth. Current chronic absenteeism data shows us that there are currently 84 foster youth who are chronically absent, which is 24% of the 350 school-aged foster youth. 36 of those youth are considered severely chronic, which is over 20%, with a breakdown of 1 elementary, 8 middle school, and 27 high school kids. That also represents 10% of the total foster youth. Washoe County Human Services actively reviews these cases, and most of them are already being case managed to identify barriers. However, we are currently reviewing the circumstances of all foster youth who are chronically absent. As we all know, mental health is also a great concern among our foster youth. Several of our chronically absent kids have been or are currently receiving mental health supports through residential treatment facilities located within Nevada and across other states in our nation. This impacts their ability to function effectively in traditional school environments. As we know, when they return to us, as our county unfortunately has very limited resources for smaller, more structured school environments that support the challenges that mental health conditions present. With regard to educational neglect, historically, there's a lot of discussion surrounding our role with educational neglect cases and reports. Per state and federal policy, Human Services cannot remove youth due to the youth solely not attending school. For some families, parents are doing everything in their capacity to get their kids to engage in their education, but are sometimes powerless at the end of the day. They can only do so much. If there are additional substantiated concerns regarding their safety, we can open an investigation to identify all of the challenges in the household, to include educational neglect. But we do not remove kids from their homes and place in foster care for not attending school. One service we do offer, which is less commonly known, is called differential response, or DR case management. The formal definition of DR is that this is an alternative approach from the traditional child abuse investigation to address child maltreatment reports that meet agency criteria for acceptance as a P3 response, but do not meet the agency's requirements for a mandated investigation. DR provides a less adversarial way of working with families who have a low to moderate risk of safety threats through the provision of prevention services to ensure child safety and well-being. DR cases are strictly voluntary for families to participate and typically last approximately 90 days. Our DR workers, we have 3, encourage families to participate in case management that may include referrals to outside agencies and assist with housing, mental health services, et cetera, as there are many needs of our families in our community.
Thank you. Are there any questions for Carrie?
All right, we'll move on to 2.05, presentation and discussion of the use of Washoe County School District Family Resource Centers to assist in addressing chronic absenteeism.
Okay, that's Rochelle Murillo for the record again. Unfortunately, I wasn't able to get Family Resource Center staff here. They're busy distributing food boxes today and food pantries. But I did want to give you a little bit of information about Family Resource Centers. So the intervention department is pretty complex. We're not just attendance. We have attendance officers, we have re-engagement specialists, but we also have Family Resource Centers, and we also have our program Children in Transition, and that program supports all of our students that are homeless. Last year, we identified over 2,300 students in our district that were homeless. And as we saw in our data, our students that are homeless are the most impacted by chronic absenteeism in our district. What we know about students that are impacted by transitional housing, by lack of access to food, by not having power on in their home, is that they are, of course, impacted by their living circumstances. And so Family Resource Centers were created in the state of Nevada about 30 years ago. They are typically nonprofits. This is the only family resource center that is under the umbrella of a school district. And it gives us a unique opportunity to have better access to students who are in need of basic needs supports. We get referrals from counselors, we get referrals from social workers, we get referrals from Washoe County Juvenile Services. We get referrals across our county, and we are entirely grant funded. So the bulk of our funding comes from Department of Health and Human Services. It's tobacco tax, and it funds some of our family resource centers. And then we also have some Title IV-B funding and some other grants that we apply for regularly. But we have 5, and the primary goal of a family resource center is to help stabilize a family. However, we serve anyone in Washoe County. We are at 5 different locations. We're at Desert Skies Middle School, we're at Sparks High School, we're at Wooster High School, we're out at O'Brien Middle School, and what am I missing? Oh, Hug High School is one of our newest ones. So we serve about 11,000 individuals each year. One of our most requested resource is rental assistance. We do periodically get rental assistance where we can prevent people from being homeless. We have to be selective in how we utilize that funding because it goes incredibly fast. But if we have families that frequently we hear at 4 o'clock on a Friday that they don't have anywhere to go tonight, we will pay for a weekly motel for them so that they're off the streets. We will help to facilitate placement in the family shelter if that's necessary. And then we look at other things. So we provide food for families. We provide clothing if needed. We have a partnership with Big Reno Drive that's happening right now as we speak. We get about 2,000 coats from them. We distribute coats to families and children in need. We distribute food boxes during the holidays, but we have food pantries at all of our family resource centers. We have closed closets at all of our family resource centers. We help with other things to establish stability long term. So if someone comes in and says, I don't have food tonight, we will give them food that day, but we will also help them apply for SNAP benefits, or we might help them apply and do the Medicaid application. So they don't have to go to the welfare office. We have established a formal partnership with the welfare office, with Food Bank of Northern Nevada, so that we can provide those services there in the family resource centers. And so it could be anything. Essentially, we do an assessment with the client or the family to better understand what are the acute needs, and then we work more long-term if a client is willing to establish some more attainable long-term access to basic needs. And so this is really important because attendance officers, re-engagement specialists, and other agencies come and we help to stabilize the family so they can better support their children in school. If we have power on, we have access to heat, we have access to lights, kids can do their homework. And they can sleep better and be better prepared for school. So I wanted to highlight a little bit about family resource centers. I'm hoping to have staff maybe at a future so you can ask them more questions. If you ever want to come tour a family resource center, I'm happy to come take you guys so that you can see what a family resource center looks like. And we are really working a lot at co-locating services. So like at O'Brien, it's a resource desert out there. And it's difficult for families to get into town if they don't have transportation. So we try to co-locate those resources there at O'Brien. Yes, I think it was yesterday they did a partnership with Baby Bounty and gave out thousands and thousands of diapers. And so it could be anything, car seats, anything that a family needs, access to formula, helping them to connect with WIC so that they have nutritional food for young infants and babies. And so anything that a family needs, we help to connect families. And when we don't have direct resources, we have trusted partnerships and formalized memorandum of understanding with other resources that we can do a soft handoff to. So wanted to just highlight that this is another effort that we have in our school district that helps to support families so they can better support their children in school and hopefully improve attendance and academic achievement. Any questions?
Carrie Pruitt, for the record, I just have a comment. I just wanted to share that Washoe County Human Services works really closely with FRC centers. Not just our DR cases, but all of our open cases, whether it's an active investigation or not. We really rely on those extra services for our families. And there's also another grant that's, I don't know the name of it, we call it the reunification grant. So when our kids are reunifying with their families, there are resources, there are some funds for them to be able to help the family.
Right. That's our
get back on
Title
the feet.
4B. It's the family preservation portion of Title 4B. Yeah. Thank you. Yeah.
That's a great service. I just want to thank you for that too.
Yeah. Yeah, we do get referrals frequently from intake at Human Services Agency. And sometimes, you know, they think they recognize that families are in crisis, but they don't reach a level that a family needs to have an open case. And so we do intervene and help support those families during that time so that we can help with access to anything that they might need help with.
All right, thank you. We'll move on to closing items 3.01. Any public comment?
No public comments received.
Sir, I may say something really quick in public comment.
Certainly.
Yeah, I do. I just want to recognize Chief Trevino. This is probably his last time here at on our council. He's retiring. I think he's already told us how many days he has left, but wanted to thank you for your time here and appreciate everything that you've done in this council. So thank you. We appreciate you and best of luck to you. Okay.
All right. 3.02, our next meeting will be March 8th, 2024. At this time, I would like to adjourn the meeting at 9:26. Thank you and have a great day.